All right, good morning, committee members and other parties of interest. The oral presentations and evaluation committee meeting for requests for proposals, RFP-24-24912, self-funded group health plan for the Human Resources Department. It's being held by means of communications media technology. Active participation will be for committee members only. This meeting is being recorded and provisions have been made for any member of the public desiring to have access to view the recording after the meeting has ended. Please be advised that the tone of silence is still in effect. All meetings and correspondence all questions, meetings, correspondence must be directed through my attention. As a matter of housekeeping for the technical advisors and project observers that are in attendance via communication media technology, please mute your audio unless you are speaking and or click your camera off if needed. If you called in, do not put the call on hold. My name is Sakina Ford and I'm the chief buyer for the project. For the record, again, the meeting is being recorded. So I'm going to hand this off to Scott Stromer, our director of procurement, for some important instructions today.
So each of the vendors claimed trade secret across the board, very broad, and you're familiar with it. So during this meeting, because this is recorded, it's up to you to protect your information and share with this group, because it is recorded and it'll be shared at meeting right now, but then like I said, we have to share the recording. So when you're sharing information, if you have it in writing, those that have copies of this, if this contains any of those trade secrets that you're claiming, we need to know that. So we can capture that information here, grab the books or whatever we need to do here. So it'll be up to you to kind of protect yourselves and don't, because once you pierce that veil, the committee may have questions about the stuff you discuss. So any questions about that at all? So we want to respect that. So
Appreciate that. Thank you.
very good. Very good.
Okay, so I'm going to ask each of the committee members to introduce themselves for the record, and I'll begin with our committee chair, Tom Fessler.
Hi, my name is Tom Fessler. I'm the county's chief financial administrator.
And then we'll go ahead here and start from the end.
Yeah. Hi, everybody. My name is Cheryl Murphy. I am a human resource manager that oversees our wellness program with Hillsborough County.
I'm Mike Drago. I'm the senior HR partner for Total Rewards.
My name is Donna Stark. I am a senior functional business analyst with Enterprise Solutions and Quality Assurance.
Tim Pearson, I'm the president of the Firefighters Union, representing 1,200 employees.
Good morning, I'm Colette Duffield with Healthcare Services. I'm a project manager that conducts monitoring and auditing of our healthcare plan contracts and our non-for-profit contracts.
Good morning, I'm Irma Muka, Budget Managing Director with the Management and Budget Department.
Then we'll go ahead and introduce our consultants, advisors in the rest of the room.
Sure. Good morning. My name is Jamie Logue. I'm a senior client manager at the Baldwin Group on the consulting side.
Jean Kelly, client executive leader on the consulting side at Baldwin Group. Nicole Defesky with the Baldwin Group.
I'm Rebecca Burley. I'm the benefits and retirement manager in BOCC HR.
Paul Almeida, the contracts manager for HR.
I'm Ernie Mayer, Senior Assistant County Attorney, Labor and Employment Division.
And we also have for the procurement side, Christine Alcino, Procurement Operations Coordinator. Okay. And online, please, if you can unmute and introduce yourself.
Ivy Martin, Human Resources Director.
Bindi Shukla, Fiscal Manager for Human Resources.
Francisco O'Neill, Union President, Local 167.
Yep. We also have Neil Gemma on the
Neil Gemma, Executive Board Member, Local 2294.
Thank you. All right, our presenters will have a total of 45 minutes, 30 minutes for presentations, and then 15 minutes for questions and answers. We will begin the timing of the presentation and we'll announce when there are 2 minutes left for your presentation. Immediately following the presentation, we'll move to our questions portion, and we will also track that time as well and provide a 2-minute warning when the question portion is almost complete. So the first firm that we have here this morning is United Healthcare. So we will let you go ahead and introduce yourselves and get your presentation started.
All right, great. Thank you. Aaron Carper, Vice President of Public Sector Sales, United Healthcare State of Florida.
Jeff Stouffer, OptumRx, Vice President of Sales.
Benson Porter, Vice President of Sales and Account Management here in Tampa. So if we are lucky enough to win your business, my team would be responsible for taking care of your employees.
Angela Hartman, I'm a strategic account executive with United Healthcare. I report into Benson. And I will be, if we are lucky enough to win your business, I would be leading the team that would be working with you.
On behalf of our team here at United, we're very excited to present to you and discuss, our capabilities. We're very, very eager to have this discussion. We want to earn your business. We want to win your business. Before we get going in this discussion, I just wanted to see, is there anything specific that stands out that you're, interested in from our proposal and or any current events that are outstanding? So, maybe we'll save that for later. But again, I'm Aaron Carper, the Vice President of Sales for United Healthcare in the public sector arm. And, I'd like to introduce our team. We've already done so, but I don't know if you want to go into any other additional detail.
Let's go.
Thank you. Yep.
All right.
All right. So if we move to, this is page 2 or 3, where it has our Hillsborough County government team. As mentioned, my name is Angela Hartman. I will be your strategic account exec should we win your business. I will lead a very robust team that you will have available to you and working for you. I specifically focus on the financials, on reporting, strategic planning, and any additional products that, as we go through your reporting and your population health that and offerings UHC has through our matrix partners, that might be of benefit to you. I'm not going to go directly around the wheel because I want to make sure that we introduce the team that's going to be facing out to you. At the bottom, we have Peyton Bailey. She's going to be the field account manager. She deals with all the communications. She'll be assisting with open enrollment, wellness planning, and any escalated service issues. The box off to your left, we'll be working closely with your on-site clinic. You will also have your on-site reps that I imagine take in claim issues or eligibility issues. And those reps will have what we call a dedicated client service manager, and they work directly with that person who has access to claims, eligibility, billing. That person's like an all-encompassing thing, and they will work very closely together to resolve any issues that might arise. But we are all hands-on-deck team. If something is elevated, we all get involved. We have Benson Porter that we mentioned, and my director, Margaret Toffoli. They are my leadership, very involved leadership team. If we need something, they are very hands-on, very involved. We mentioned Aaron Carpenter. He's leading the sales process. Should we be lucky enough to win your business, Lillian Padilla will be the implementation manager. She is responsible for getting all the information in, making sure it moves downstream in a timely manner, making sure ID cards get out the door, making sure you are claims ready on day one. I've worked with her in the past. She's wonderful. And then Dr. Danny Madrill, she's our chief medical officer for the state of Florida. I work with her very closely as we review your population health management and identify gaps in care and any clinical programs that might be available and helpful to the members of Hillsborough County. Inside that circle, I'm sorry, real quick, then we have the internal team that I work very closely with in terms of customer service, network, clinical management programs, eligibility. It is my job to make sure we are coordinating with all these different internal partners to make sure that you are having a good experience and a smooth transition.
So on the next slide, we're very eager to partner with you to help manage not only the benefit portion of your program, but, also the budgeting. This is a very significant line item in your budget, and, we want to be there alongside with you. And so, with respect to the financial highlight or components of our proposal, we did put forth a very competitive ASO fee out of the gate. Included credits up front in that first year, and then also a wellness allowance, as you see, in those additional years. Did include the on-site representation that was included in the RFP. So your full-time customer service reps, your nutritionist, your wellness health educator, all are included in our bid. The shared savings program, as outlined in your RFP, we've met that guideline. Also are providing a discount guarantee for you. We're very confident about our network and our discount in this area, and that speaks to that. We are including an employee medical center, as outlined, with what you are currently receiving with your current vendor. We're going to match that and include that as well. We're very proud to have matched our 13.5% MWBE spend. We're very proud of partnering with our diverse and our underserved population and our businesses in the community. And we're very proud that we've met that guideline per this RFP. And one thing that stands out in our bid, in our financials, there are no capitated costs that are included or any capitated expense running through your claim wire. So, any behavioral health capitation, radiology capitation, there were some items that were outlined in questionnaire, question and answer number 2, addendum number 2 that has been outlined. Those look like somewhere in the estimate of about $6 million annually that is running through your claim wire account that are not claims. So you will not see that in our reporting, moving forward. So we're very confident that we're providing a very competitive proposal for you and allow you to attract and retain the top talent that you need here in Hillsborough County.
Okay, so on slide 5, just high-level overview of who United Health Group is. I've been with United Healthcare and Optum combined 23 and a half years. Very proud to work for this organization. We're the 4th largest company in the United States. We have about 485,000 employees, and that includes global operations. We operate in 30 countries. United Healthcare, that's your administration, your network. Our clinical programs are housed on that side. Surest, we'll talk about Surest briefly. That also is part of United Healthcare. And on the other side, the other primary division of United Health Group is Optum. Our wellness programs, technology, our pharmacy, PBM is part of Optum Pharmacy, and also the data warehouse. So while we are this massive organization and all those resources are standing behind you, if we're lucky enough to win your business, we like to think of ourselves as a Florida-based company. So there are about 30,000 employees in the state of Florida. We operate out of, I think it's 43 offices across the state. And again, my team is in Tampa. The team, if we're lucky enough to win your business, is housed in Tampa primarily, and that's led by Margaret and Angela. So just high level, wanted to let you know who we are. I'm not going to spend much more time on that, Aaron. So why don't we go ahead and talk about the network?
All right, great. Thank you, Benson. So very proud to offer our Choice Plus network as part of our proposal. It is the largest proprietary network in the United States. In the industry, it's the largest that's out there. In the evaluation response, we found a very significant percentage of your providers are in our network, nearly 100%. I mean, 98.5%, 99% of a match on that. There's a very, very good chance that your doctor is in our network. There's a very significant concern, when you're talking about switching carriers and so forth. That should be put to bed with the fact that our network is very strong and robust, not only here in Florida, Hillsborough County, but also the nation. An interesting tidbit that stands out in a recent RFP for the state of Florida for January 1st of 2024, United Healthcare was awarded 34 counties in the state of Florida for state of Florida employee business. And that includes Hillsborough, Pinellas, Pasco, anything in West Central Florida, all dominated by United. And that evaluation was made through network discounts and network access. So we're very strong in this area, very strong throughout the state, and very strong nationwide. The access to behavioral health services and mental health services is probably at an all-time high, right? Following COVID, everyone and anyone needs access to behavioral health services. And we are very proud to offer the largest behavioral health network in the industry in this state of Florida. We have nearly 3,000 providers in Hillsborough County alone to support your employees and families when they're in their time of need. That amount is nearly double what it was just back in 2021. So that shows the need and the importance in our organization to make sure that we're providing significant access for your population. And so in addition, not just the 3,000 providers, but immediate access. In today's age, there are times where members need care for quickly and can't wait the 2, 3, 4 months sometimes in the system that other providers have for these services and to be seen. We have a segment of this network called Express Access, where we guarantee that a member upon outreach will be seen within 5 days. And that is very significant in this space. Mental health, again, a very significant concern. I don't want to call it a problem, but it's a very significant concern in our world today. And we think that we've been able to have a solution here that tackles those challenges head on. And in addition, we're also here for the first responders, and we have vetted local resources that are available for our first responder population and are providing free care for themselves and their families in local locations available here in Hillsborough County. So network, I think we're obviously very strong on a number of fronts on that, but also want Jeff now to go into some of our pharmacy components.
So Jeff Stouffer, Optum Rx Pharmacy. I've been in the industry for 30 years with Optum for 15. This is a very difficult benefit to figure out, the gamesmanship out there. So I think it's very important that we highlight Senate Bill 1550, which has passed, and it's looking for transparency. Optum Rx has led that strategy for numerous years. We feel comfortable that anything that you need is going to be fully transparent. We're following all of the Senate Bill 1550 guidelines. I would challenge some of the other carriers out there that their interpretation is not up to the level that we believe needs to be for non-ERISA groups out there. So we'll help you get your attestation correct, follow all the guidelines, make sure that you're following that in compliance. The power of integration is very important with pharmacy. So the number one used benefit. So I applaud you guys to keep that integrated, keep it going like that member experience, and the opportunities that arise when you combine the integration, medical and pharmacy data are tremendous. We look at groups that are carved out with pharmacy, with UHC. We looked at groups that are integrated with UHC. When it's integrated, there's a significant opportunity for savings. And we can look at specific cases that will drive up to $26 per member per month on what you're experiencing now. I looked at some of your data. There is some very low hanging fruit that I think that we can come in and easily look and save with low member disruption. And there's some other challenges. And that's what I like about my team is we get very consultative, the business plan, looking at years 2, 3, 4, 5. What do we need to do to help continue to manage that trend and spend? Your team, I'm sure here in the consultants are looking at your specialty. So that is an extremely important component. You are about 2% of your claims costs is driving how much specialty spend. That's a rhetorical question. It's about 52% of your total pharmacy spend is being driven by specialty. So that's what you need to focus on. You need to make sure that you have your Humira biosimilar guidelines, your Stelara biosimilar guidelines in place, and how those particular biosimilars are going to replace the originators. And that strategy, we can definitely get into details with you as we do some planning. The last piece I'm going to talk about here on slide 9 is that next best action. Our technology is going to empower your members to make better decisions. We want to make your employees be better stewards of their healthcare. that next best action is looking for ways to move somebody from a high cost medication to a lower cost alternative, to move them to a better distribution channel from going from maybe retail to mail, making sure they're using our exclusive specialty pharmacies that are going to manage those specialty costs better than just an open pharmacy strategy. So extremely important to look at the guarantees, the rebate guarantees, the discount guarantees. Those are spreadsheet comparisons that your team is doing, but you need to take that to that next level. What's that technology going to do with that information to try to get those members in lower cost healthcare channels? The next piece here, slide 10, cost-effective outcomes, extremely important. We talked a little bit about integration. Your toolbox is vast at OptumRx. We can look at different formularies. We can look at plan designs. We can look at networks. Formularies that are using exclusions will help drive higher rebates. And those exclusions, medications that treat the same disease state, but at a lower cost. And I see a lot of our challenges coming into these public sector bids that everybody kind of wants that open formulary. We don't want any member disruption. That's important. Member disruption is a concern. We can take a look at continuation of therapy, meaning grandfathering, same term, to have a transition that's smoother. But I think when we were looking at the formularies compared to that, we have some formularies that are going to drive significant savings with less than 3% disruption. You're always going to have some disruption going from one carrier to another. I don't want anybody walking away from here and saying, oh, there's not going to be any formulary changes, any medication changes. That's just not going to happen. If someone's telling you that, they're not being transparent. But the solutions that we have here that I can see is going to be less than 3%. And then we can walk you through during implementation about how that member communication would occur as well. And then on the right side, just to kind of wrap up my piece here, your data, Angela referenced it earlier, your data is going to be very important how to plan and make sure that we're monitoring and looking at these high cost medications. Right now, we're seeing from your data based on that I looked at is a $10 PM cost. I referenced 26 earlier. You are on kind of that lower mid-level of low managed healthcare for RX. There's some opportunities again to move you to that right side and get more highly managed. And that's the fun part of my job is what's the cost savings versus member disruption. That's what we're here for. That's our toolbox. CFO sitting right here, we can say, we can save you $5 million, his hands going up, his or her hands going up, saying, absolutely. HR team saying, but how many members is that going to be disrupted? That's the opportunity that we need to discuss. What is that worth? But we can also move you down the continuum. And there's some other information there. That integrated piece and looking at medical and pharmacy together is extremely important. We're agnostic to where that medication needs to be dispensed on the medical side or pharmacy side. We are looking for that lowest cost alternative and lowest distribution center for you as an employer. So the solutions are here with OptumRx. Excited if we get the opportunity to go into more details with you.
Thanks, Jim. And as I mentioned before, we are excited and committed to partnering with our diverse and our, partnering with our folks that are serving the diverse and underserved communities. We're excited. It helps create jobs and gets everybody, of all different backgrounds engaged in the community. And we're very proud of achieving that 13.5% spend with the on slide 12, the partners that we've outlined in our RFP and our bid. And so just as a time check, we're approaching 20 minutes. So we've got about 10 minutes remaining. So last but not least, I really want to speak for a moment about our innovative ideas and programming here within United Healthcare. And on slide 13, there is no bigger opportunity for innovation and no bigger product within United and within the industry like Surest. And what Surest does, it takes the data that we collect and it ranks our providers in, ultimately, which providers out there are providing the best outcome for our patients. The infections, complications, readmissions, et cetera. And so, we're using that data and we separate the kind of the best of the best. And using a variable copay structure, we're incentivizing members to visit certain providers accordingly with a very minimal, and in some instances, no copay at all to go see the best of the best providers, with respect to quality of care, readmissions, infections, et cetera. And, the likes of Google, Apple, Best Buy, all are on board with the Surest program. And so, again, this variable copay method is very exciting, driving members to the providers that have the best outcomes in the space, again, with a minimal, and again, in some instances, no copay. On the slide 14, some caveats here and some exciting, pieces with Surest. It's a copay-based program. It's utilizing the Choice Plus network so that our members have access to that largest proprietary network in the country. Again, no copays, it's a copay-based program, no deductibles, no coinsurance. And what that means to our members, no surprises. I mean, the confusing part about healthcare, you go to a provider, you go get an MRI, they don't take a payment at the provider, and then you wait and see 2, 3 weeks, 4 weeks for that bill to come in, and you never know what really it's going to be. With Surest, there is going to be an upfront cost, a budgeted cost, a transparent cost that your member is going to see and understand and pay that cost. And that's the extent of the cost for that service. So that really takes the guessing game, so to speak, and the surprises out of the healthcare system. And, and personally, that's one of the biggest challenges and complaints, I guess, that I have sometimes. I don't know what I'm going to pay. I go to the doctor, and if it's not a copay, I don't know what I'm going to pay. And so this Surest program, really helps comfort me knowing that here's what I'm going to pay for the service. And, it's great with respect to transparency and understanding. What are some of the results that help with Surest? Plan savings. So initially, we see between 5 and 15% savings year in, year out with the Surest program, based on the high level of outcomes from the providers that are here that we're promoting via the variable copay perspective. Savings for members with no deductibles and no coinsurance, you're going to save money, and 20 to in the upwards of 20 to 60% on your out-of-pocket costs for your care. Member satisfaction and understanding, like when you understand your benefit program, you're going to be happy about it. It's a whole different understanding and a whole different world, with respect to healthcare. 82% of our Surest members say that they're happy and they understand their program, as opposed to 9% in a traditional, PPO or HMO or high deductible environment. It is very significant out there. And so again, it's a wonderful, innovative idea that is growing rapidly within United and in the industry, because of the data, again, that's collected and what we're able to do with that and drive people to the providers with the best outcomes.
I want to add something to that. I think it's important for you to understand we're not restricting access. Okay, so look at it this way. You come to an intersection, your doctor's the right-hand turn. Go, okay? But we're giving you the information that it could be less expensive, and the left-hand turn might be the better physician, the better choice. So it's not restricting access whatsoever, okay? It should, again, giving you information. And in my mind, the idea behind this is making healthcare affordable for your employees. That's the outcome. What we're seeing with it isn't necessarily that the employees are going to the least expensive doctor, but what we are seeing is they're not going to the most, and that's the win. That's the win for the health plan. That's the win. I mean, for your benefits, when you're trying to keep things within budget, there's your win. Keeping them away from the most expensive, but the choice is still there for them. So I hope that helps.
Thank you, Benson. And don't take it from us. We've provided a number of local and state references that I know Angela has something to speak on here as well, but we mentioned the state of Florida. We've also got local resources within this community and the city of Tampa and all its government nearby. And so, Angela, do you have anything to add?
Yeah, I mean, the references are just a list of United Healthcare clients. I personally work with the city of Tampa and the city of St. Petersburg. I have also worked with police and fire unions and know the intricacies that go with that. And so, if we're lucky to win your business, I've got experience with a spectrum of municipalities, including police and fire unions.
I guess I forgot also, the state of Florida selected OptumRx as their sole PBM carrier in 2024. We replaced CVS. So I think something to highlight too.
Thank you.
Okay, so we did pretty well. It was like speed dating. So I'm going to close this, and I do want to address something, right? Just it's wearing on me. So everyone knows what took place last week, and there is misinformation, out on the internet with the 30. I believe the number's 32% denied claims by United Healthcare. We have no idea where that number came from. Okay, so we are doing our research to get the actual numbers. We're going to pull. We think later this week we'll be able to pull this information by client. But I want to let you know, in the commercial space, it's less than 10%, and really it's between 5 and 7% is the actual number. So that is misinformation. I wanted to address it. I didn't want to be sitting here in the room and have that in the back of your mind as we're presenting everything that's wonderful about United. That was a tragedy. BT, someone I knew, so it hit me personally. It was horrible. So closing this, we had a customer, one of our references, who left our team 3 years ago, and they came back. They're coming back 1/1 of this year. They couldn't wait. And so I think that is one of the best examples I can give you. This is a public sector entity like yours across the bay, right? Probably can figure it out. I can promise you that if we earn your business, we will take care of your employees. I was in the room, I think it was probably 10 years ago, when the decision was made to go to Cigna. And I remember sitting there as Jeff Swenson was my counterpart at the time over at Cigna. And I'm like, we're gonna win this case one day. I can promise you that. So you better treat them right. And I have been waiting for this opportunity to get in front of you again. And, when I sit here and say we're going to take care of your employees, our customer service scores, it's the net promoter scores. Florida has the highest net promoter score for this Fortune 4 company. Tampa has the highest net promoter score in the state of Florida. So my team is the best of the best. And it is at a level of just, it's best in class. And so that's the reason I can make this promise to you. We will take care of you. We'll work tirelessly to make sure your employees are getting the care they need. Our goal is simple. If you have an unhealthy employee, we want to move them into that healthy bucket as quickly as we can, get them the information and care that they need so they can move in that healthy bucket. We want to keep people as healthy as we possibly can. If you have employees who are living with illness, and make sure they're getting the right care at the right time. They're seeing the right doctors, again, getting insurance. And United Healthcare has this information also, so that we will get your employees to the right care. They can make the best decisions. So, but again, they're getting the right meds. So we are taking care of that condition the best we can. And as complicated as healthcare is, it's that simple. And if we can accomplish that, I guarantee you're going to have a happy population and as healthy a population as we can make it. So we want your business. I want your business personally, and can promise you we'll take care of you. So we want to thank you for this opportunity to present. And then we'll move into the question and answer. And I think we beat it by like a minute.
Okay, so we will move into question and answer period for the evaluation committee members. And if anybody has a question, feel free to go ahead and get started.
Let me just remind the committee, again, you have access to information that was marked as a trade secret under Florida law. So when you're asking questions, just be very mindful of those questions. If you're going into exact numbers or something, you may want to kind of ask that a little bit. They'll know what you're talking about and they can come back to an answer. So just be mindful if you pull something out. If you have any questions, just holler. We'll deal with it. So, all right, thank you.
And just as another reminder, the question and answers are for committee members only.
That's okay if I.
Okay.
Hi.
Hi again.
First, I do want to express my condolences for your team. And also I just want to express something that you had mentioned about the denial of claims being a self-funded funded health plan. You know, when I heard that, I'm just like, that's, you know, neither here nor there, didn't believe a word of it, to be honest.
Right.
So,
Thank you. I'm glad.
Thank you.
But you never know, because, you know, everything's on the internet. It's true.
Yeah.
Right.
Yeah. Okay, so I have a few questions. Okay, so talking about the network, you have just a very small percentage that you weren't able to meet. Could you just speak quickly on what type of doctors those might be in that network? Are these just general practitioners that just have to be part of the network, or are these like specialists that we should be concerned that our employees wouldn't have access to that specialty care? And if you don't have that answer right now.
And I'm pulling that response. I'm pulling our disruption analysis up as we speak.
While he's pulling that, so the network team was led by Kate Shaughnessy. She just retired, sits in the office with my sales and account management team. So, and this comes up often where there is a physician that an entity would want in the network. We simply go over there and say, okay, we need to recruit this physician, and they're there to do that. So I just want to let you know that happens often.
I'll get back to you on that question.
Thank you. I appreciate that.
Let me make sure that I get that information accurately for you.
You were talking on behavioral health. We'll go there. You mentioned that your program, I don't know if you used the word guarantees or what that word was. I apologize, I don't remember. But you said they would be seen within 5 days. I'm not familiar. What's the average usually? Are you familiar with what the average would be? How does the 5 days stack up to that average?
I don't know what the average is. Would you happen to have that?
I don't have the average, but I'll just give you a personal example. Just going, I lost my mother last year and was going through a hard time. And so I was seeking counseling. And in full disclosure, I do not have United Healthcare. I'm on TRICARE for Life because my husband is retired military. But it took me 3 months to get in to see a provider. So that being able to have that access and being able to get somebody in 5 days is astounding, because it took 3 months for me going through the military network to find a provider.
The idea behind it, I believe the increase or usage of, I call it Fast Pass, right? It's like, because I live in Florida and I think about the Disney Worlds and whatnot. And I think it's the access or the request to use this service is up like 300%. Not everyone's going to do it, but the idea behind this is we recognize the need for behavioral health, and a lot of this came as we were moving through COVID. That's really, we started ramping up our network at that point to say we need to get access points, because we recognize the delay that Angela was just sharing. So when those situations occur where a person needs to get to a mental health professional, it's there to guarantee the 3 days. So I don't know what the average is, but you just need to be rest assured you have access to the Fast Pass.
You'll find my questions are.
Yes, ma'am.
It's fine.
Yeah. Huh? You'll find my questions are more of experience questions. By now. So, all right. Let me see if I can read my own writing. Oh, you talked about the pharmacy consultation, and How often would we hear those types of numbers? Is this something we're only going to hear annually, semi-annually, quarterly, or is this something that you constantly look at that when you recognize something that looks out of whack? Are you contacting us on that?
Yeah, so I would recommend probably quarterly, looking at overall numbers. And then we'll have a limit for a large claim. Right, what do we set our large claim at, 25, 50?
Depends on what they want to set it at, but, so that is actually something that I would do. I would be scheduling through BKS and with you, however you want to do it. Do you want to do it quarterly? You want to do it biannually? You want to do it once a year? That's up to you. Now, as we first start out, we're going to have limited data, of course, so that it'll be very immature. So I would say like maybe the first time, maybe wait 6 months, but after that, after a full year, we'll sit down, we'll do an analysis, we'll look at different opportunities to address. And then from there, that's up to you. You want me here? One of my police and fire unions, I had to be there butt and seat every month. I had to be there. So that's up to you. You tell me how you want to do that. Thank you. Thank you for that.
And that information also, depending on what we are able to pull from, I think it's Express Scripts, right?
Mm-hmm.
All right. The information we pull, Jeff is very good proactively sitting down with you saying, here is where we're seeing the disruption. So you can get out ahead of it with communication to the employees to say, FYI, here's a disruption and here is the answer. So we can address that so you don't have as much noise as we're moving through implementation, et cetera. Okay, and post implementation. Because the first thing that's going to be used will be the pharmacy, most likely. Okay.
Okay, cool. Sorry.
I actually have one question kind of on that.
Yeah,
same
please
vein.
do.
Can I ask? So Jeff, you had mentioned that you had seen in looking at our current plan, some low hanging fruit. And then some other challenges that would maybe be a little higher level. Would you be able to provide an example or two of what you see as low hanging fruit and then those higher level challenges?
I think I see a lot of the kind of that brand name medications that we can get over to the generics. I think there's an opportunity there to get your GDR higher, generic dispensing rate. You guys are, I'm sure, looking at your GLP-1s. I'm looking at that every day with our clients, making sure that that's going to the type 2 diabetic medication, or if you're covering weight loss. You probably have seen everything in the news just recently on advertisements that Zepbound is producing better weight loss than Wegovy. And how is that going now to affect your members? That's the type of information that we have to start discussing, because now these members are going to be switching. Is your rebate language correct for Zepbound compared to Wegovy? Is that ingredient cost lower? So those are the strategies that are being discussed daily internally, and then we take those out. So those are the two kind of big examples right now that are the hot topics that I see from yours.
Thank you. To piggyback on that question, I'd like to know how, just briefly, I know, and maybe it's a long answer, I apologize. How are you guys treating the biosimilars? Are you allowing those to be part of the maybe step therapies?
So we're allowing, if you're an existing Humira member, you can stay on Humira, but any new members have to go to Amjevita, which is the biosimilar. That, think 15 years ago when we were saying generics are the better way to go compared to a brand. They were saying, oh, generics don't work as well. Generics work just as well as a brand, but they're lower cost. That's the way we're in right now with the biosimilars. We're trying to drive to a lower cost alternative with a different manufacturer. And that's what we're going to see now with these high cost medications like Humira and Stelara are the big ones now that are moving over. But if you have an existing Humira person, no disruption, they'll be able to stay on there. Any new person that needs that type of medication is going to go to Amjevita.
And ma'am, the majority of the disruption in the analysis that was provided looked to be in the drug rehab, inpatient detox arena, but not the primary care, not the specialty, not your local providers.
They want to jump in? I'll give you the chance. You've got to keep talking.
Piggybacking off the pharmacy questions, let's say a member tries a lower cost drug and it's, either is not as effective or they have an adverse response to it, is there a pathway back to the original prescription, or are they limited to stay on a lower tier?
Absolutely. There's a pathway. Yeah, step therapy is exactly. We want you to try that lower cost alternative to see if it works first. We'll never leave a member without medication that's required. You'll have an exception process for that as well. Yes.
Can you spell out a little bit what that exception process looks like?
So the member's going to apply to be reviewed. They'll have a peer review on that. So that would go through your pharmacy account manager, somebody, a day-to-day person that Angela kind of explained in that wheel of support. So the members would have access to that. Pretty easy. You'll find that that's going to be pretty low on the opportunities for your members with the formularies we have, but there is a process for that.
Thank you.
If we wanted to bring in a Mark Cuban cost plus specialty pharmacy, is that something that we would be allowed to do?
No, and here's why. So you have a service called Price Edge. Price Edge is designed to find those lowest cost generics that what Mark Cuban's process is. He wants to provide that lowest cost alternative in the generic formulation. So Price Edge will look for those lower cost opportunities at the pharmacy and apply that to your member copay or co-insurance. And that's just going to happen in the background. So we see what that was kind of doing out in the marketplace, and internally we designed a program that's going to basically match that. Yes. Got to remember, generics don't generate a rebate. So, but that is a lowest net cost strategy that your consultants can kind of help to take a look at. So some of those rebates are actually a lower cost alternative, and some of those brands may be pushed into tier 1. There's 4 drugs right now that do that. And then when that doesn't happen, those medications would move out of that tier because we want that member taking that lowest cost alternative in tier 1. So that's intrinsically happening all the time with some of these. I'll call them ankle biters because they're out there trying to kind of nip and tuck at the big 3 PBMs. But they just don't have the buying power that an Optum RX does have. And ultimately, your ingredient costs will go down with a big player like Optum RX.
You got about 5 minutes. Oh, okay. Sorry. Okay, then I'll switch. Let's talk about the Employee Medical Center. Thank you for including that in your proposal. Is the cost of a visit going to be a claims cost, or will it be a set visit cost?
No, I guess depending on the type of, and I guess how is it set up currently?
Fixed. It is a fixed cost.
Yes, there's a claim. So, we would be able to adapt that however that our member would want to have that. So if you want it set up, as a claim cost or a fixed cost, however you want to have that set up, we will be able to work with you and partner with you over it.
2 of the questions are quite lengthy in response, so I'm not sure if I have the time to ask them, I'm sure. So unless you can give me short answers. One of the things that you said, and as I said, I'm the experienced person, right? You mentioned that you're going to work hard to take that unhealthy person to be a healthy person. Can you talk through some of those steps quickly on what's the approach that United Healthcare has through that? My second on that is, are your on-site reps UHC employees or are they contracted?
There's many components to this, but
Okay, I know, that's why I'm like, that's probably like.
clinical, et cetera. But a great example, level 2. Okay, level 2 diabetes program is a program we rolled out a few years ago. Essentially, it's the only type 2 diabetic program that the goal is to move the employee or spouse into remission. And it's a program where we give the type 2 diabetic a monitor that they wear that's tapped into United Health clinicians who are monitoring everything they're eating, whatever's causing spikes, to identify and give them what I call is the key to their body, right? What are they doing that's causing these spikes? And then the goal and what we're seeing is we're actually moving these type 2 diabetics into remission. So it's the multitude of programs that United Healthcare brings to bear. And that's one I'm just really excited about because it actually is working and it's moving these type 2 diabetics into remission. That's a great example I give you. But there are a multitude of clinical programs that we would bring to bear depending on the specific situation.
And I apologize, I don't recall the answer to this. Your chronic condition programming, are those additional costs to the ASO pricing?
There are some, I'd have to look at the actual proposal to see what we
Go back and look at it
Okay,
again.
but I, just to kind of piggyback off of that, through our care management program, you know, we have a spectrum, right? Not at risk, chronic conditions, and then comorbidities. And there is a team that looks at claim algorithms, and they of course approach the comorbidities and the people that are chronic conditions first. And what's essential about that, and it's essential that we put out there, why is United Healthcare calling? Because a lot of people are like, why is United Healthcare calling me? I'm not picking up the phone. I don't want anything to do with it. But those people are there to help. And they're there to make sure to help, you know, are you taking your medication, making sure they're in compliance with their medications? Because a lot of times people, I don't want to take my drugs anymore. I don't want to take those anymore. Making sure they're in compliance, making sure that they're following up with their provider. Do you need, oh, your doctor told you need to go see a different specialist? Let me help you make that appointment with one of our tier 1 providers. So those are the types of things that they're doing to try to keep members in compliance, to move them into healthy, as well as motivating them to get to where they need to be. So I just wanted to get that other example.
And those on-site representatives are funded by our proposal. So if they're currently with Cigna today, our goal would be to talk to them and see, you know, should we have the pleasure of earning your business, we would talk to them about, you know, coming on board with United. If they happen to be, you know, Hillsborough County staff, you know, we'd be able to help accordingly through that as well. But
I'm gonna start to hog any more questions. I'm gonna shut up.
So we have a health intelligence platform and we would need a data feed going to that health intelligence platform. Would that be an issue? I thought I saw something, but I couldn't tell.
Get that set up at point of implementation.
And then for prior authorizations, would we be able to adjust prior authorizations to say what we want? Not when it comes to specialty drugs, but like radiology. Would we be able to set that up to where we would?
So did you come on board with us? It's about a 3-hour call. And we go through line by line by line. How do you want this to get set up? You know, do you want these to be prior auth? Do you want these not to be prior auth? It's a detailed call and it's bring your copy.
You're self-funded, so it's what you all decide how you want us to administer the plan. You tell us.
Any other questions at all? But I want to make sure everybody, you know, that you have your, don't worry about the time. This is pretty important.
I do have one other question. In your credits included, the 700,000 and 175,000.
yes,
Are those each one time only or are they annual?
so the first number, the 700 is the first year and the 175 is annual.
And a follow-up is the 175 negotiable.
Everything.
Of course,
Everything
everything is.
negotiable every bill.
But yeah, we would love to have the opportunity to discuss this further.
Colton, do you guys have any questions at all? Well, thank you.
Thank you.
Thank you all.
Thank you, everyone, for attending. Thank you for being here to present. I will go ahead and end the recording and we appreciate everybody's time. For the committee, we will have a few minutes and then we will be due back for another one. So, thank you.
All right.
Everyone have a great
Thank
day.
you.
Merry Christmas, happy holidays.
Wow, yes.
Hey, can't believe it's almost